I guess people that had no insurance, maybe no income, maybe were in an economic edge that they, although we had a lot of doctors, is this on recorded?
Yeah. Well, we're rolling, so I can capture what.
Okay.
You don't have to say
But,
things that you don't want to say, but
no, I know, but
apparently you could help some people in that arena, but others you could not. So talk about that. Those people that fell outside the boundaries of your typical healthcare at that.
right. So in one of the offices right across the street from the hospital, it was Bay Baptist Association, Baptist Hospital. Some of the churches, there was a group that started this clinic, a not-for-profit charity clinic, to see people that didn't have other means for getting care. And we had a lot of volunteers, and we're able to give a lot of good care to people that normally, probably some of them wouldn't even try to get care because they didn't have insurance and they, couldn't pay the bill. So I guess that would be kind of the starting
How have
of.
you seen it grow? What is your perspective on? You obviously started something new, didn't know where it was going to work or not. You knew there was a need there, and obviously now it has fulfilled everyone's wildest dreams, I'm assuming. What's your perspective on how important this clinic is now?
Oh my gosh. I don't even know where to begin because there are so many more people that are really in need. And especially, a lot of it is, a lot of the professionals that render care require insurance or payment plans or whatever. And there's so many people, like the working poor is a lot of what we serve. And the working poor, a lot of them, they work just enough hours and that they don't get insurance. And they fall through the cracks. And that is a lot of the people that we see here that are just really, it's just such a needed thing. And I think there's a lot more out there that we haven't even reached yet. But we have new ones come in every day.
Yeah. Is there one particular story or person or client or patient that you know of or situation that you could share with us to prove that it's been worth it?
Oh my gosh, there's so many of them. One of them especially is a woman and her husband. They work at the mall. They get just enough hours, but they don't get insurance. They come here. They have participated. We have a lot of programs. They have participated in the programs to lower cholesterol, do lab work, exercise, the foods, fresh vegetables every other week, that supplies by Manna and the Levin Firm and all that. And about a year, maybe a year and a half ago, she came up to the front of the office. She said, guess what? I don't have to take insulin anymore. I'm not a diabetic anymore because of all the programs that she diligently, and of course her husband helped her to follow the plans or whatever. And there are other programs like that, but she was one in particular because she was just thrilled. And now every other week or two, she brings us in a loaf of homemade bread from her zucchini plants and stuff. But anyway, that's a really good story. And there are more of them like that.
Yes.
If they follow the programs, there's a lot of really helpful programs here.
Touch your heart.
They do.
Any other one that you can think of that just affected you in learning that this place had helped them?
Oh my gosh, they're flashing in front of my face. There are a lot of them. Oh, a lot. Oh, there's one couple that both of them were coming here, and they were both on programs. It's a lot of diabetics, and other things, and weight loss, and, all this. And there's a couple that was coming here for a long time, and one day they came in, and the man said, look at this, I can now get my arms all the way around my wife. I just cracked up. Oh, that was the best one.
That's a good one.
Yeah, that is a good one.
Carol, what would this community be like without this facility?
Oh, there'd be a lot more hurting people out there, and that weren't getting care, that were sick or hurting or dying or whatever because they weren't getting any care. I know that the other facilities around, they see patients in emergency purposes and whatever if they don't have insurance or don't have any of their indigent care. But here it's just a more personalized, it's just a better care.
Talk about the volunteers and the number of physicians, dentists, all of them that give their time. Obviously you couldn't do it without them. Had there been any, what's the reward for someone that might be considering bringing their services?
It's in your heart. It's just a reward. It's in your heart that you're doing really good. You're doing God's work. You're doing really good work here for people that need it. And there's a lot of, I worked at Baptist Hospital for many years, and we've got doctors, nurses, whatever, that have retired, and some that haven't even retired yet, that give of their time to come here and help our patients. And you just feel rewarded for you're doing something positive.
Is there anything that you want to tell me that we could include, or that I haven't asked, that I wouldn't know about? Something maybe you thought about leading up to this interview that you could share with me?
I only had 30 seconds leading up to the interview because Sally roped me right out here.
You gave me some good stuff.
Probably.
I just don't want to cut you off.
No, I mean, I'm sure if I had time to think, there's a whole, I started here when I retired from Baptist at age 75, 4 years ago, and came over. I was going to work 1 day a week for 4 hours, and then it was 2, and now I'm here 5 days a week for 4 or 5 hours or more. It's just very rewarding. It makes you feel good.
I was going to say, why keep doing it? You could be
Makes you feel good, and it makes, oh no, I play golf every afternoon. Most every afternoon. And I have the kids. No, I do a whole lot of stuff. But, instead of watching Good Morning America or something, watch Michael Strahan and all them on TV, I could be doing something worthwhile.